We're back now with Dr. Darien, taking a look at a new study that suggested eating more fruit, dairy, and fiber and caffeine just may lower tinnitus risk. Explain.
Yeah. So tinnitus or tinnitus, this is known as that constant buzzing or ringing in the ear. Sometimes it can be constant, sometimes it can be intermittent, and it can be disabling in terms of your everyday life. There's been a few studies that have tried to look at how our diets affect our risk of developing something like tinnitus, but it's been really difficult to follow that. Now this new international study follows over 300,000 participants looking at their diet, looking at their risks, and they found that certain factors in diet were significantly associated to the risk of developing tinnitus or tinnitus. Most importantly, fruit. 35% reduction. So those who had enough or more than enough fruit in their diet had a 35% reduction in their risk. Other factors, dairy, caffeine, and fiber. The other factors that you would think might be effective, for example, fat and sugar, had no effect, whether or not increasing or reducing the risk. Reasons why the dairy, caffeine, fiber, and fruit might be the effective reason is because it might be associated with antioxidants, anti-inflammatories that might reduce your risk. But overall, as to why exactly is that cause, it's difficult to say.
So there's not a pattern as to what foods you should have and which foods you should avoid?
Yeah, I think from this, it really takes into effect about how you can change your diet and increase the things that you might not have enough of. For example, if you have more fiber, if you have more caffeine, dairy, and fruit, then you'll likely have a reduced risk, but it doesn't mean that it's going to cure it. So if you have a diagnosis already, simply changing your diet might not get there. You want to talk to a doctor about other risks. For example, blood vessel problems, certain medications can increase your risk. And then when it gets down to it, you can talk about your diet.
I mean, because it still seems like fat and sugar is still okay.
Yeah, it seems that way, but I would still caution because fat and sugar can increase your risk of something like pre-diabetes, which we know is associated with an increased risk of tinnitus. So you still have to be mindful.
Doc is like, clean it up. There are so many other reasons to get away from the fat and sugar.
Eat healthy.
Right?
Very simple and short.